Bruxism, the secret habit that's destroying your sleep and teeth. Do you wake up with jaw pain, headaches, or even chipped teeth, but have no idea why? Millions of people silently suffer from a nighttime habit that's quietly wrecking their sleep and their health. It's called Bruxism. And today, we're diving deep into the history, causes, symptoms, and treatments of this sneaky tooth grinder. By the end of this video, you'll know whether your teeth are staging a secret rebellion at night and what you can do about it. Let's crack it open. Believe it or not, bruxism isn't new. Ancient Egyptians actually noticed teeth were in their mummies. Yes, some pharaohs were hardcore grinders. Archaeologists called it the silent killer of smiles. Fast forward to the 17th century. Dentists noticed patients with weirdly flattened teeth, but no obvious cause. They suspected demons. True story. People actually thought evil spirits were grinding their teeth at night. It wasn't until the 20th century that science stepped in and said, "Nope, it's just your jaw muscles going rogue while you sleep." A fun fact: Beethoven had his own challenges with hearing loss. To continue composing, he clamped a rod to his piano and held it with his teeth to feel the vibrations. While not related to bruxism, it just goes to show people have always had creative ways to deal with issues affecting their jaws and teeth. So, why does this happen? Why are our jaws turning into overworked little machines at night? Stress and anxiety. Think of your jaw as a sponge soaking up your stress. You don't even notice it, but at night, it's like your teeth are at the gym doing heavy lifts. Sleep disorders. People with sleep apnea or snoring issues are more prone to bruxism. Basically, your body thinks it needs to fight invisible sleep monsters. Malocclusion. Fancy word for teeth that don't fit together right. Your bite is like mismatched puzzle pieces, and sometimes they just rub the wrong way. Lifestyle triggers: caffeine, alcohol, smoking, certain medications. Yes, that late night espresso might be making your teeth throw a rave. A fun fact: some people grind their teeth while awake too. It's called awake bruxism. Basically, your jaw is moonlighting at your office desk. How do you know if you're secretly part of the grind club? What are the common signs? Jaw pain or stiffness in the morning, headaches especially around the temples, worn, chipped or flattened teeth, earaches. Yup, your jaw can annoy your ears. Your partner telling you sound like a chipper hamster at 3 am. Imagine your teeth are soldiers and every night they're at war without a break. No wonder they get battle scars. If left untreated, bruxism doesn't just give you a sore jaw, it can lead to TMJ disorders. Your jaw joint can start screaming for mercy. Tooth damage. It can lead to cracks, chips, or worn enamel. Basically, your teeth start looking like coins in a fountain. Sleep disruption. Grinding affects sleep quality for you and sometimes your partner. Headaches and neck pain. Because your muscles are basically overachieving all night. A fun fact: studies have shown that people who grind at night often develop a subconscious jaw habit during the day, like their teeth are rehearsing for a nightly performance. So, what can you do to stop your teeth from turning into mini jackhammers? Night guards. Think of them as tiny helmets for your teeth. They protect your enamel and prevent chips. Stress management. Yoga, meditation, or even just taking a deep breath before bed can calm your jaw muscles. Behavioral therapy. Some people need help learning to relax their jaw during the day. It's like teaching your teeth to take a coffee break. Medication. In severe cases, doctors may recommend muscle relaxants or Botox to calm overactive jaw muscles. Lifestyle tweaks. Reduce caffeine, alcohol, and avoid chewing gum excessively. Your jaw needs a vacation too. Treat your jaw like a Tesla. It's powerful, but if you never stop and recharge, something's going to break. So, whether it's stress, sleep issues, or just your teeth being rebel soldiers, bruxism is more common than you think and it's fixable. If you notice jaw pain, headaches, or strange tooth wear, talk to your dentist. A little intervention now can save a lot of tooth drama later. And hey, don't forget to subscribe for more fun, fact packed dental tips because your smile deserves superstar treatment. Protect your teeth, protect your sleep. Thank you.